Yeah, so the question, so we know that the plasma cells are the cells that produce antibodies when they have become like a part of monoclonal gammopathy, like in MGUS and myeloma and smoldering myeloma. Then the plasma cell is sick and then produces monoclonal antibodies, but the healthy plasma cells, they produce antibodies. So people, in particular patients, have been worried that if you get a vaccination for COVID, you activate a lot of, and it's a complicated mechanisms of action, how these vaccines work, but ultimately they activate plasma cells to produce antibodies against COVID. So people have been worried that if they have an underlying disease in their plasma cells and they are producing antibodies, the monoclonal antibody, if you give these individuals a vaccination, that might somehow trigger their plasma cells and their underlying MGUS or smoldering myeloma to progress, so that they could move them from MGUS to maybe myeloma. So short story, it doesn't. So we have a lot of information. It's nationwide in Iceland, so we know every vaccination has been given in all our individuals. We have repeated serum samples after that, and so we can follow that before vaccinations became a thing and then afterwards. And we can see there's absolutely no difference in the M spike before and after vaccination. And this is true for those that get one shot or two or a booster, and it's true for all the 4 different vaccinations that are available at the moment. So it's perfectly safe, and we recommend people with MGUS and myeloma to get vaccinated.